My name is Mark Vincent. I am 58 years old. I have worked for the hospital almost 23 years. Leading up to my heart attack, I had agreed that day to go work on the floor and actually do some admitting of patients onto a floor there at Baptist. At lunch that day, I began to have heartburn, which I rarely do. I was admitting a patient probably around 6 o'clock, 6:30 that evening, and I'm in the patient's room and just got very, very hot. Began to sweat profusely, had a wave of nausea that went over me as well. Excused myself from the patient's family, went to the nurse's station. I didn't realize, I guess, how bad I looked at that point. Dr. Chris Gainey, Dr. Carla Brady were the two ED providers that took care of me. I had known them for years. And Gainey looked at me after just a very few minutes in the ED, and he says, "Mark, you're having a heart attack." I knew that the cath lab was not open there at Baptist, and he says, "We'll get you over to Richland to the cath lab and let them take care of you." They ended up doing 3 stents on the right side of my heart. That's where the blockage was right-sided. Came home from the hospital. They had asked me, just part of the discharge piece, did I have an interest in cardiac rehab? And I said, well, sure. I want to do that. I know it's a good thing to do, and I'll plan on doing that.
Cardiac rehab and pulmonary rehab are programs designed that are medically supervised to take care of patients that have had some type of cardiac event or some type of pulmonary disease. They exercise with us. There are nurses, exercise physiologists, a dietitian. We have respiratory therapists here that all work together to take care of the patients.
Great classes, good teaching. The exercise physiologists are phenomenal. The nurses are incredible. Support staff is just awesome. They just really, really individualize our treatment plan to kind of meet us where we are, to strike that balance between pushing us and encouraging us at the same time. And I stayed as what is called a phase 3 patient. Vicki Yandel, our nurse manager, at that time asked me, she said, "Are you interested in doing some things with us, nursing-wise, as far as cardiac rehab goes?"
A lot of times the patients, when they come to us, we tell them we don't know what they've experienced, but Mark actually went through this, which made him a perfect person to be on staff to help with us. His background in psych allowed him to have that personal touch with the patients that we kind of missed a little bit. So he was able to talk to the patients about stress, depression, anxiety, and he was able to relate to them as also being a patient.
I had the opportunity to do that for the last year for cardiac rehab. That's been very rewarding. Once again, getting to hang out with a great team. I was very fortunate. I was fortunate to be where I was at the time, fortunate to get down to the ED and get the care started, and also to have the availability of the cath lab folks and then the good care in the heart hospital to get me home. But I do feel like I've had somewhat of a do-over to able to enjoy family, enjoy life, be healthier as I'm trying to enjoy all those things that I'm so blessed to have.